I wanted to help them as a person in addition to their joint. I showed them ways to get there. And then a
Mhm.
light just switched on. And these people have now lost like 60, 70, 80 pounds since we had that. And they continue to lose weight. And they come back, and thank God I didn't have any complications with them. They all did wonderful. And
Mhm.
they are so thrilled with their surgical outcome. And now that I have changed their life, not just their joint,
Mhm.
and they're continuing it, and everyone in their community is noticing it. They're saying, Bill, you've lost all this weight. How are you doing it? You're doing wonderful. You're walking. You're not limping. And that helps the mental health component tremendously. So I think giving people hope is huge. I know
Mhm.
that's a long winded way, but yes, I've had multiple patients that through a structured weight loss program, given goals, given guidance, given hope, showing them that you care, it resonates with people and they know they have to change, but you just gave them the hope and the motivation to do it.